Are you ready to learn 13 more positions for birth? Partners, are you ready to learn some techniques that'll make you a hero in the labor room? Let's go see how we can max our relaxin'. Welcome, I'm Ellen Contard.
And I'm Melissa Evans.
We've been supporting growing families for a long time.
We've come to realize that quality childbirth classes are really hard for growing families today, both in terms of calendar and budget.
So we've decided to do something revolutionary. We are offering our full, comprehensive childbirth class series right here.
Please realize that we are not medical providers nor attorneys. We do not practice medicine nor the law.
So use common sense and talk things over with a professional that you trust.
But for now, let's learn another 13 positions to help your labor be relaxing and comfortable. So one of our favorite tools is a birth ball. Now the rest of the world might call this a yoga ball or a therapy ball or an exercise ball or what have you. But for us, it's a birth ball. And this can be mom's best friend. It's important to get a ball that is the right size for mom's height. Ideally, her femurs are going to be just about parallel to the ground and her feet are going to be firmly, flatly planted on the ground. You might want someone or something to hold on to as you get used to balancing on one of these little boogers. But they're soft and they're squishy and they help mom's pelvis open and relieves pressure there. It also lets mom rock and sway and maybe even bounce. After baby comes, you'll find there's a lot of bouncing. So this might be a slightly more restful way to soothe the baby than walking 3,000 miles.
When mom is in this position is a great time for partners to do the standing shoulder press. This is peaceful for mom and restful for partner as well. We put our forearms on mom's shoulders, right where they slope down, and just lean in a little bit. Mom will tell you if you need to adjust your positioning or how much pressure to use, but this position can be very relieving for mom.
So one of the cool things about hospital beds is that they can kind of be your own little mini roller coaster. I mean, they're not terribly exciting and no loop-de-loos, but they do go up and down pretty well, and you can use this to your advantage. By simply raising the bed up, we can then put the ball on the bed, and now mom can stand and lean on it. Just because there's a bed in the room doesn't mean you have to lie down and act sick. There are a lot of ways to use this in a much more productive way. So now mom is here, she can rock, she can sway, partner can rub back. There's so much winning going on like this.
Instead of using a throne made of 200 pillows, mom can also sit and lean back against that squishy, relaxing birth ball. This is a great time for a partner to give a nice foot massage.
So this ball also has another hidden talent. Many moms will want to go onto their hands and knees, but it gets really hard on our hands. So leaning on the ball can encourage mom to be in that forward position and still allow baby to kind of dip down low, relieve pressure on the back, encourage baby to be anterior instead of posterior.
While mom is in this great position, we can use a maneuver that was coined by Ina May Gaskin as shaking the apple tree. We put each hand around one of mom's thighs and we start jiggling it in a small, fast motion as if we were rubbing two sticks together to start a fire. It's unbelievable how much this relaxes the lower part of the body.
So if mom wants to sit down in a stable chair, not a birth ball at this point, a really cool thing that the partner can do is a knee press. This is where the partner simply presses up against mom's knees. It is a firm and continuous pressure. It kind of shifts everything in mom's pelvis up a little bit and relieves some of that pressure in the lower back. It can be really, really comfortable. Sometimes moms actually prefer for a partner to pull instead of push. Give them both a try. See which one you like best.
Sometimes a mom feels a need to sit with one foot up and one foot down on a couch or a bed. As Dr. Bradley said, it's not ladylike, but it is mother-like. Generally, if our body is asking for this position, it's because the pelvis needs to open up or the baby's position needs to tweak in a certain way, so it's good to listen to that instinct.
So back to that hands and knees position that is so comfortable for moms. Sometimes you don't have a ball lying around, but that's okay, partners. You have a lap and you'll do just fine. So if mom's on her hands and knees, but she can rest her head on your lap, and now you can rub her shoulders and offer those kind words of encouragement to help her keep going through her journey of birth.
Remember that lunge from our first positions video? This is a position that has a lot of those benefits, except it gets us out of gravity and more relaxed. It's the side lying lunge. So in order to do this, mom lies on her side on the bed or the couch. Partner kneels down, and it's best to put up the knee closest to mom for support. Mom is going to bend up her knee, and partner is going to put her foot into your abdomen or chest while holding up her lower leg to give her support and keep her leg in place at right angles. Then mom can push and pull and rock back and forth. Partner can follow her lead so that she can get that good asymmetric positioning and relaxation.
Again, using the bed plus dancing, you get dancing on the bed, but not you, partner. You stay on the ground. Mom can still lean while kneeling on the bed. She can still rock, and partner can still support her. Labor can be a really nice time to connect.
Mom gets her rest and deep relaxation in the side lying position during labor. Dr. Bradley said to lie however you lie when you're sleeping. In her book, Natural Childbirth the Bradley Way, Susan McCutcheon describes the one right way to do the side lying position as the running man. It is important when you're doing side lying to roll yourself forward just a little bit. I promise you're not on your belly squishing the baby, just so that your bottom arm has somewhere to go back behind you. This is important because then your body is fully stable and no one part of the body is stacked on another, which relieves pressure and allows us to get truly deeply relaxed. Now, if you don't like the running man position, try it once, you never have to do it again, and you can always flip up your arm and do the murdered chalk outline instead.
So while mom's resting on the bed, it can be possible for her pelvis to kind of end up closing up, and that's clearly counterproductive when there's a baby scheduled to come through that pelvis. So a really awesome tool is a peanut ball. Not quite a ball, but you get the idea, right? Most hospitals carry these also, and you can buy them online. Mom simply puts it between her legs, and it helps her pelvis stay open so that she doesn't have to pay any closing costs while she's lying down and resting.
So while mom is on her hands and knees is a great time for a power maneuver called the double hip squeeze. To do this, we find the little divots in mom's pelvis kind of between her lower back and her bum, and we put the heels of our hands in there and we push up and in toward her spine. This relieves so much pressure on the back, and it is completely magical. An alternative way to do this, if that placement is a little difficult, is to grab both the sides of the hips and then we push up and in.
So hands and knees is really, really comfortable for mom. Here's another amazing tool partners can use. This is officially a rebozo, or a Mexican shawl or scarf. Quite frankly, you can use a pashima scarf or a towel or a bed skirt, whatever strip of fabric you happen to have lying around. So we wrap it around mom's belly and hammock it. Mom can get down to that beautiful hands and knees position that most of them like. Partner needs to make sure that they are centered. You do not want to do this off to the side. Your back will thank you for it the next day. Take one side of each fabric on each arm and lift up until you hear mom sigh with relief. That's it. During a contraction, this is all you have to do. It simply relieves the pressure on her back. It's surprisingly comfortable. Gently, of course, and applying constant pressure all the way around so we're not hurting baby in any way. Between contractions, you may want to do a little bit of jiggling, sifting. It's kind of like that shaking the apple tree, a very small and fast motion, nice and rhythmic. It can help relax mom's muscles in her belly that are less than voluntary. And then when a contraction comes again, holding still, she wouldn't like the jiggling at that point.
Using these tools and techniques right now in your pregnancy will ensure that you're able to use them on the big day. So your homework for this episode is to give each of these a test drive. See which ones you love, which ones you hate, and keep an open mind, because remember, one that she likes now, she might not love during labor, or vice versa. But get them all into your muscle memory.
So there you have it. 13 more positions to add to your homework for a total of 26 in your tool bag right now. We really hope that you give them a try. Let us know in the comments which ones look super exciting to you or which ones might not work so much. We really love reading your stories.
Please like this video and share it with all of your pregnant friends. And do remember to subscribe. We'll be posting new classes every Tuesday and Friday, and we wouldn't want you to miss out.
Until next time,
know your options.
Own your birth.